What if I told you millions of women are having sex but not enjoying it? They're smiling, they're pretending, they're enduring. But inside they feel broken, no desire, no arousal, pain instead of pleasure, silence instead of satisfaction. And the worst part, they think they're the only ones. Today, we're exposing what experts quietly call the secret epidemic, female sexual dysfunction. And if you've ever felt disconnected from your own body, this video is for you. Welcome back. This is a safe space for real conversations about women's health. And today we are breaking one of the biggest taboos in reproductive health, female sexual dysfunction. Not shame, not judgment, just science, solutions, and empowerment. What is female sexual dysfunction? Female sexual dysfunction, FSD, is not just low libido. It includes persistent problems with lack of sexual desire, difficulty becoming aroused, trouble reaching orgasm, pain during sex. If it causes distress, frustration, or relationship strain, it matters, and it is more common than most women realize. Studies show up to 40% of women experience some form of sexual dysfunction at some point in their lives. That is not rare. That is a silent epidemic. The four main types, explained simply. 1. Low sexual desire, hypoactive sexual desire disorder. You rarely or never feel interested in sex, even when you want it. 2. Arousal disorder. Your mind wants it, but your body doesn't respond. Poor lubrication, low sensitivity. 3. Orgasmic disorder. It takes too long, feels muted, or doesn't happen at all. 4. Genitopelvic pain disorder. Pain during penetration, burning, tightness, or fear of pain. Pain is not normal. Let me repeat that. Sex should not consistently hurt. Why does it happen? Female sexual response is complex. It's not just physical. It's hormonal, emotional, neurological, relational. Let's break it down. Hormonal causes: low estrogen, postpartum, breastfeeding, menopause; low testosterone, thyroid disorders, PCOS, birth control side effects. Hormones influence desire, lubrication, and sensitivity. Psychological causes: stress, anxiety, depression, body image issues, past trauma. The brain is the most powerful sexual organ. If it doesn't feel safe, relaxed, or connected, arousal shuts down. Medical and medication causes: antidepressants, especially SSRIs; diabetes, high blood pressure, chronic illness, pelvic surgeries; relationship factors: emotional disconnect, poor communication, resentment, performance pressure. Desire thrives in emotional safety. Signs you should not ignore: persistent low desire causing distress, pain with penetration, vaginal dryness unrelated to hydration, sudden loss of libido, difficulty reaching orgasm despite stimulation. If it is bothering you, it is valid. Now let's talk solutions, because this is treatable. 1. Get a proper medical evaluation check. Hormone levels, thyroid function, blood sugar, medication side effects. Sometimes the solution is as simple as adjusting medication. 2. Pelvic floor therapy. Weak or overly tight pelvic muscles can cause pain and orgasm issues. A pelvic floor therapist can be life-changing. 3. Address vaginal dryness. Water-based or silicone lubricants, vaginal moisturizers, local estrogen, if prescribed. Dryness is physiological, not a personal failure. 4. Stress regulation. Chronic stress suppresses libido. Practical steps: 7 to 8 hours sleep, exercise 3 to 4 times weekly, mindfulness breathing, reducing cortisol triggers. When stress goes down, desire often rises. 5. Communication and emotional intimacy. Desire is not just physical stimulation. It is feeling desired, feeling safe, feeling emotionally connected. Sometimes therapy, individual or couples, is the breakthrough. 6. Stop faking. This is important. Faking orgasms teaches your partner the wrong pattern. It reinforces disconnect. Honesty builds better intimacy. What is normal? Libido fluctuates. After childbirth, during stress, during grief, during hormonal shifts, temporary changes are normal. Persistent distress is not. The truth is, you are not broken. You are not too much. You are not enough. Your body responds to your biology and the environment. And pleasure is not a luxury. It is part of well-being. Healthy sexuality improves self-esteem, relationship satisfaction, hormonal balance, mental health. This conversation is not dirty. It is medical. It is human. If you have been suffering silently, this is your permission to seek help. Talk to a qualified healthcare provider. Ask questions. Advocate for yourself. Female sexual dysfunction is common. It is real. And it is treatable. You deserve pleasure. You deserve comfort. You deserve a body that feels like home. Call to action. If this video helped you feel seen, like, subscribe, and share with another woman because silence protects stigma, but knowledge sets women free.